Okay, well, I think we're going to get started, even though it looks like we don't have everybody on yet, but we'll get going in the interest of time. Thank you all for joining us tonight for the April Neighborhood Health Series. Glad to see you and hope everybody's well. Special thanks to Clark County Credit Union. We have Craig Fraley here, who will speak in a couple minutes. Thanks to Clark County Credit Union, we are able to do this series, and we will be returning to an in-person format in September. So we're really looking forward to that. With that, just a couple of housekeeping items. I am recording this, and this recording will be posted to the speakers.roseman.edu website, where you can see all of the past presentations, as well as learn more about the upcoming presentations. And what we'd like you to do is, if you have any questions, please put that in the chat feature, which we'll be monitoring throughout the night. And then certainly we'll be taking the majority of the questions at the end of the evening, and we hope it turns into a conversation. So with that, wanted to talk to you a little bit about the objective of today with World Health Day. As Manas and I discussed this presentation, we had some questions that we wanted to try and answer throughout this presentation. As we move into the 2-year mark of a global pandemic and consider our global public health, what lies ahead for our families, communities, and our world at large? How do different countries fare in their own public health initiatives that contribute to global health? What diseases do they face, and what kinds of resources are available and lacking? What factors in communities contribute to public health, access to water, healthy environment, healthcare and food? And what are the barriers and inequities that exist in access to care globally? With that, I'd like to introduce our presenter and share with you his bio. Dr. Manas Mandal is a Fulbright Scholar and a professor at the Roseman University College of Pharmacy. Dr. Mandal earned his PhD from Jodhpur University in India and received postdoctoral training at the University of Chicago and University of Michigan. Dr. Mandal is an adjunct faculty with JSS, AHER, India, and Mauritius. Dr. Mandal's expertise is in immunology and vaccine research. He has been awarded a Fulbright Scholarship in 2021 by the U.S. Department of State and World Learning to teach a course on infection and immunity abroad. He has given many TV, radio interviews, and webinars on COVID-19 to the audiences in the US and abroad, and he's published in major immunology and pharmaceutical science journals and presented at the American Association of Colleges of Pharmacy, American Association of Pharmaceutical Scientists, and American Association of Immunologists professional meetings. He is professionally involved with pharmacy education, research, accreditation agencies in the US. He lives in Henderson and enjoys gardening, photography, and hiking. With that, I'd like to present Dr. Manas Mandal.
Thank you, Vanessa. I appreciate that kind of introduction, and thanks all the attendees. I really appreciate you joining us this evening, and let's see if we can learn and discuss what's global health about, and particularly focusing on the current pandemic in our mind. With that, let me try to achieve the technical feat. Now, someone tells me on the other hand, do you see my screen that I'm sharing with you? And you hear me well. All right, thank you. Thank you everyone once again. Today is the World Health Day. And what could be better on this evening talking about global health? Now, this is a slide thanking our sponsor, Clark County Credit Union, please.
Thank you. As the Medical Field Credit Union, we are very proud to sponsor Roseman's Neighborhood Health Series. And we're also member owned, and we give all of our profits back to our members at the end of the year. If you should ever find yourself needing financial wellness, please visit our website at ccculv.org. Thank you, everybody. Have a wonderful evening and enjoy tonight's presentation. Back to you, Dr. Mandal.
Thank you, Jimmy. Always we are grateful and appreciate for the Clark County's involvement and encouragement to us. So these are the learning objectives. Following our pedagogy, that how we teach our students in class and discuss health sciences with them, we always begin a discussion or teaching with the learning objectives. In today's presentation, we will define what is global health. And believe me, in the next few slides, you will find that there is not a really solid consensus opinion what constitutes or what is defined as global health. It's sort of a loosely defined terminology. Then we'll discuss into the parameters and aspects of global health, meaning what constitutes global health. Subsequently, looking into the current global health concerns and who are the partners in maintaining that global health situation and keeping the world a healthy place. Next, we'll discuss the interrelationship between the public health and global health. These are the two domains that are very much intertwined with each other. And we will establish that when public health in a community, in a country, in a nation is good, that leads to a good global health overall. And essentially, a healthy nation is a prosperous nation. Subsequently, we will talk about CDC and WHO different programs that are geared in maintenance of a global health, focusing on infection such as COVID-19, HIV, tuberculosis, and malaria. After that, we will delve a little bit into environmental aspects that also impacts global health profoundly, such as availability of clean water, global climate change. What are these two aspects impact on global health? And finally, we will review where US stands in the realm of global health. So let's begin with defining global health in celebration of World Health Day. So today is World Health Day, April 7. Every year, it is celebrated to draw an attention to specific health topic of concern to people all over the world. And incidentally, April 7th was also the founding day for World Health Organization in 1948. That was several decades back, right after World War II, when the world leaders understood that there got to be an agency worldwide operating, serving our planet to stay healthy. So following that, the theme of 2020, this year's World Health Day, is Our Planet, Our Health, meaning it envisions a healthy planet that ultimately leads to the global health and overall good health of its inhabitants. Can you imagine a world with clean air, water, and food is available to all of us that allows us to remain healthy and at a well-being state? And can you imagine where cities, I will add to next to the cities, can you imagine cities and villages and neighborhoods that are livable and where people in those cities, neighborhoods, and communities have control over their health, leads a healthy life, and overall leading to a healthy planet for us that we can live for our children and grandchildren. So let's take a look at look around the world at public health and global health. So how do we define global health? And as you can see, there are lots of definitions from different individuals, such as Copeland from Kickbush, but the definition that coined by United Kingdom's government, that seems the most encompassing definition of a global health, which states that global health is focused on people across the whole planet rather than the concerns of a particular nation. It recognizes that health is determined by problems, issues, and concerns that transcends national boundaries. Also, worldwide improvement of health through reduction of disparities and protection against global threats that disregard the national boundaries by McFarnell. These two definitions particularly embraces the idea of transcending the global boundaries, and thus we can define global health as a consensus opinion, such as healthcare at international and interdisciplinary level that aims to improve health and healthcare equity for populations worldwide. And essentially that transcends the national boundaries. In US, Centers for Disease Control, such as CDC, do have a Center for Global Health that protects not only Americans, but that works worldwide from dangerous and costly public health threats, such as it was instrumental in COVID-19 and other vaccine preventable diseases, such as other infectious diseases, HIV, tuberculosis, and malaria, and it responds when and where health threats do arise. Because one thing for sure, after 2 years into the pandemic, into third year, that no one is safe until everyone is safe. That is so true for COVID-19 pandemic. So what are the concerns of global health in 2020? When I researched to prepare the presentation, today's presentation, I stumbled upon several different areas. Then I thought that why not categorize global health in the domain of infection, such as COVID-19, HIV, malaria, and tuberculosis, metabolic and inflammatory disease condition that impacts global populations, such as type 1 diabetes, various cardiovascular diseases, malnutrition. We do not oftentimes really think about chronic malnutrition in US, but worldwide chronic malnutrition triggers infection and leads to premature death. That's one of the most concerning element of global health today. Also, on the heels of COVID-19 pandemic, for last 2 years at least, there is a tremendous toll on mental health and well-being, such as social instability and recent war in Ukraine. Finally, climate change is also very important aspect in maintaining global health, such as how do we control pollution? Do we have a clean water, clean air to breathe? That triggers respiratory diseases, heat-related wildfire, and global climate change triggering tsunami, flooding, including different areas in United States that compromises the global health. So overall, these are the broad topics of global health, but I will focus today's discussion actually in infection, climate change, and associated global health issues. So at the very beginning, I want to discuss this very important concept. Is global health a really high-income country's concern? And who is the custodian of global health? Although the burden of preventable diseases predominantly falls under middle and especially low-income countries, yet global health centers located mostly in high-income countries. Because several decades back, right after World War II, global health, the concept of global health and WHO was built on international health interests and policies that governs those agencies that essentially originated in high-income countries and country-specific institutions, sometimes over a century ago. These institutions, such as National Institutes of Health, now fund centers in low and middle-income countries that engaged in global health issues, and an interest in global health stems from strong national public health institutions, which are usually not a good feature of low and middle-income countries. And you have these logos down below in this slide, such as Centers for Disease Control, US Global Health Institution, ECDC, European Center for Disease Prevention and Control, European counterpart, and overall, the worldwide apex body, World Health Organization. Now, CDC Center for Global Health that publishes their annual report, and some of the highlights of 2022 annual report from CDC's Center for Global Health calls for strengthening capacity to advance health equity in science, programs, policies, and communications that leads to strengthen global preparedness, detecting and diagnosing disease conditions prior to it striking the world and the communities. It talks about fortifying linkages, provide leadership, and build preparedness and responsive capacity in collaboration worldwide. It discusses intensifying, innovating, and sustaining and adapting various proven interventions that we, the world population, learn through so many decades of research and understanding the global health. Therefore, these are the keystones of CDC's global health efforts worldwide. True global health security requires a strong public health system partnership and collaboration with agencies from all over the world in different countries. And long-term comprehensive strengthening of public health system is the foundation of equity in global health and is the foundation of health security. So over and over again, the concept of equity in global health and a strong foundation for health security comes up in the context of global health, and which is very true with the ongoing COVID-19 crisis. And we need to be prepared for the next infectious disease threat globally. So when one talks about the complexity of global health, one should consider income potential, that income potential of individuals and country as a whole, that leads to the life expectancy of the inhabitants or citizens of that country, and particularly child and adult mortality. And finally, at a granular level, we can break down the complex global health issues in a country and in a neighborhood in that specific country, neighborhoods in that specific country. So the issues for global health is actually very complex and granular. One can trace it absolutely to the neighborhood level. So let's begin with some data about global health. When I started thinking about this presentation, then first thing I looked at, what are the data available to discuss and talk about various disease conditions and various issues that concerning global health scenario today. There is a profound movement of population from low to higher income between 1990 and 2011 led to better health and life expectancy. Without going through the details of this graphical representation, you can simply look at on the left-hand side, panel A shows the low-income population worldwide was 3.1 billion, but from 1990, that low-income population is now 2.5 billion worldwide. So the low-income population over a decade has shrunk significantly, whereas also high-income population worldwide has increased. So is the upper and middle income population increase. What it tells us? It tells us there is a positive link between better health, increased life expectancy, and GDP in a country per person. That's what it tells us. So better health and life expectancy is positively correlated and associated with higher income potential in the inhabitants and citizens of those countries. And we are in a positive direction globally in terms of global health. Second data point that I like to bring to our attention here is that female life expectancy and increased adult mortality, which has decreased over the years. Now, left-hand side panel, the graphical representation shows female life expectancy at birth for selected country and the standard country, meaning the country that does the best, that is shown on the left-hand side, this blue line. Japan is the best performing country for last 20 years, followed by United States and Mexico, China, India, and Ethiopia. These are the countries represented in this graph. On the right-hand side, the bar diagram represents annual rates in decrease in adult mortality by sex and income group between 1992 and 2012. What is important in this diagram is that rate of decline per year in percentile, such as particularly between men and women, decrease in annual mortality, adult mortality. Over the years, in least developed countries, it kind of remained the same around 1.5, whereas more developed countries, the number is quite significantly lower. But in China, India, these are the two most populous countries in the world, we still see really high percentage or number of individuals in terms of adult mortality, but it is decreasing. Mortality is decreasing by sex and income group between 1992 and 2012. Particularly in India, male populations that is significantly doing better compared to the women population. And thus, this shows us the disparity between sexes in a country like in India, where in terms of the health and well-being is different between male and female counterpart. So we have seen unprecedented progress and unanticipated challenges in global health in the past 20 years. The data point that I showed in the previous slide refers to some of the data point, but I will bring to your attention some of the highlights of the achievements. The number of under 5 deaths fell from 12 million to 6.9 million between 1990 and 2011. Under 5 mortality fell from 87 to 51 per live birth. And this is a tremendous achievement in the context of global health. Number of maternal deaths worldwide fell from 546 to 287,000. That's a significant decrease in the maternal death worldwide. And global maternal mortality ratio also fell from 400 to 210 maternal deaths per 100,000 live births. These rates of increase in life expectancy in second half of 20th century in some countries are at least, such as China and Mexico, are at least twice as fast as in high-income countries, which is a good sign, because we always think, when we think about global health, that Western world, the most advanced countries in the world, as if they are the countries that kind of the repository, or they are the leading in life expectancy in the realm of the global health. But things are changing. This is the data that shows that even China, the most populous country in the world, and also Mexico, there is a significant increase in life expectancy, which is one of the prominent indices of global health. However, the rate of decline in maternal child mortality would not be sufficient to reach the target for 2015. And that remains a concern worldwide, that we need to sustain the momentum of maternal and child well-being and reducing their mortality, because an individual is only healthy individual and achieves a full life's potential when mom is healthy and rears the child and raises the child as a healthy child. Then the child becomes a healthy citizen and serves his country, his or her country, and the world population. So there are links associated or established between health and gross domestic product per person, because to remain healthy, we need to have some resources. Without going through the details of this diagram, essentially, if we focus our attention in the middle of the diagram, the higher GDP, gross domestic product per capita, it is linked to improved child health and the nutritional support that child receives. Ultimately, when the child becomes an adult, it also leads to improved adult health and nutrition. And through that linkage, there is higher GDP, increased labor productivity, and increased ratio of workers to dependents, and ultimately leads to the larger labor force and increased investment and physical capital all over the world. And that leads to the increased access to natural resources and improving global economy. So overall, our individual health leads to the better global health that creates a higher GDP per capita worldwide and raises our living standards worldwide. So how it contributes to the change in life expectancy, to growth in full income. There are a lot of bar diagrams, but without going through the details, one notable aspect I will draw your attention. If you pay attention to the sub-Saharan Africa between 1990 through 2000 and 2000 through 2011, average annual growth rate in value of mortality relative to the base income percentage, this is very notable. Whereas high income countries such as Western world, this is the data, which around 1, scale of 1 or unit of 1, whereas between 2000 and 2011, that number hovers around past 5% base year income, meaning average annual growth rate in value of mortality relative to base year income percentage is more favorable in high income countries and worldwide compared to the sub-Saharan Africa and many South Asian countries and Middle Eastern countries and etc. So there's a direct link between mortality and base income of that country, meaning a prosperous country, usually a healthy country. When it comes to US, in terms of neighborhood income and health parameters in US and globally, we see where we live, meaning a geographical location of where we live, we raise our family, care for our families, friends, and neighbors. That matters for how long we live, meaning where one lives, that area determines the longevity of that individual. A glaring example would be life expectancy in US, certain US neighborhoods, particularly this neighborhood is in Washington, DC area. It could vary by 30 years between a specific neighborhood in Washington, DC area compared to more affluent, wealthy areas in Washington, DC areas. Therefore, a specific place, race, and class shapes how well and how long people live worldwide. As personal health is impacted by socioeconomic status, global health is also largely dependent on the income and particularly the earning potential and where one lives. And the data on the right-hand side supports this idea: child deaths and births by region and wealth quintile in India early in 2000s, where you see that in rural area, the percentage of under 5 death percentage and population percentage is pretty high. Whereas when you look at the small urban region versus large urban region, there is a significant differences between the child deaths and births in the rural versus small urban versus large urban areas in India. And that can be translated into births and deaths, which intercepts around wealth quintile 3 here. But essentially, there is a distinct differences between where one lives and what is their wealth status that determines their longevity and well-being and healthy lifestyle overall. So what health does to us, essentially? So far, we are trying to establish the importance of having a healthy life and world health in that context. What it does really, improved health essentially leads to increased personal and national income. And that is a very strong statement. When we talk about building a nation, building a community, we need to invest in health because improved health raises per person income directly through 5 main channels, such as it increases the productivity through education. And if we have proper investment, that leads to the access to the natural resources, and overall the demographics remains healthy, longer living. Therefore, they are more productive and they contribute to the society where they live much more compared to unhealthy nation or not so healthy community. Moving forward from this point, we will focus on different aspects of global health, meaning what contributes to the global health mostly. Certainly, we would not be able to touch upon many aspects, but when I was thinking of this presentation, what I thought that why not bring our attention within a short span of time, the most glaring and most impacting factors in the global health, which is immunization. When you think about immunization, currently in the context of COVID-19 global pandemic, it becomes very, very important that we understand that immunization is a global health priority. Not only from these agencies such as CDC, ECDC, European counterpart of CDC and World Health Organization, but essentially through immunization or vaccination, we can and we do save lives, prevent diseases, and vaccination are the most cost-effective intervention to maintain national and global health worldwide. It has demonstrated large-scale impact through immunization and improvements of health through effective strategies with clear targets. The impacts of vaccines is broad and far-reaching, not always easily and consistently quantifiable, analyzed, or communicated. But if you look at the table down below, don't need to go through the numbers, but these were the dreaded diseases at one time point, such as smallpox, diphtheria, measles, mumps, rubella, pertussis, polio, or tetanus. And in these areas in 1920 through 1948, 1952, these are the numbers of these respective diseases. And through vaccination, on the right-hand side column, we have the percentile reduction. Almost in every instances for every diseases, we have been able to reduce this disease by 100%, if not very close at 92, 97, 94 percentile level. So that's the power of immunization or vaccination. It is the most powerful health intervention to bring global health to an absolutely perfect level if we could administer the vaccines nationally and globally, particularly for current COVID-19 infection. So what are the health benefits of vaccination? That brings to the next topic of discussion. Health benefits of vaccination is very simple. It reduces infectious diseases, morbidity, and mortality. Without going through this graphical representation, but if you look at the left-hand side, this graph is that from 1998 to 2018, these are some of the diseases such as diphtheria, measles, neonatal tetanus, pertussis, polio, and rubella, which has their prevalences or incidences at high level in 1998, but we have been able to conquer through vaccination majority of these disease condition, but unfortunately some of the diseases are on the upswing, such as this graph showing measles is in the uptake, and there are reasons for that. And vaccines are estimated to prevent about 4 to 5 million deaths per year, and it saves 386 million lives and 96 million disability adjusted life years globally. So that's the power of vaccination and immunization. Now we can translate those numbers into the COVID-19 vaccines. I will show some data at the very end of my presentation, but immunization and vaccination are the most impacting interventions to maintain global health. So immunizations to improve global health currently prevents 4 to 5 million deaths per year. Vaccination triggers herd immunity that eradicates various infectious diseases and prevents infections. Immunization is the most successful and cost-effective public health interventions that ever been, as a human race, we have been able to come up with. And on the right-hand side, this is a little bit old data from 2002. It essentially shows the percentage of deaths from vaccine-preventable diseases, such as pneumococcal diseases, rotavirus, measles, pertussis, tetanus, and Haemophilus influenza. Little old data, some numbers definitely have changed, but you can see that even in 2002, these are the percentages of vaccine-preventable diseases occurring worldwide. In terms of routine childhood vaccination coverage in 204 countries and territories between 1980 and 2019, a systemic analysis for the global disease burden was done by this phenomenal Lancet article in 2021, very recent article. The dotted line represents the global health burden target of reaching at least 90% coverage by year 2020. And the solid line represent the mean estimates for each vaccine. And what are the vaccines we have? We have polio vaccine, DTaP, and HIV, Haemophilus influenza B, and rotavirus, and various polysaccharide capsular vaccines. So without going through the details of the impact of these immunizations globally, we can say that globally the proportion of childhood vaccines and vaccinations are increasing. Thus, it is bringing this disease condition down globally. And if you want to read a little bit on this little detailed data, you can refer back to this Lancet, very recent article about last year's article in Lancet that talks about the impact of immunizations and vaccination in global health. And through the global immunization, many of these diseases have been conquered, but unfortunately, some of the diseases are also in recent years in the resurgence that you see. We have to increase the coverage, reaching to the Global Health Alliance target, and it is almost there. But for some disease conditions, such as rotavirus C infection down below, you see we have way to go reaching the global health target. This graph shows the total number of zero-dose children globally and global burden of the disease in some super region covering between the year 1980 and very recently 2019. Again, the sub-Saharan Africa leading the chart, which is this line in various disease conditions where a majority of the population in sub-Saharan Africa and followed by Southeast Asia, Asian countries, and various North African, Middle Eastern countries, they have not received the much needed and yet available vaccines. Take home message out of this slide, these two diagrams, line diagrams and bar diagrams shows that number of zero-dose children on the right-hand side panel, meaning these children have not received any vaccination or immunization. Again, leading the chart in this area is the sub-Saharan African countries, whose children in a large number have not received any available life-saving vaccination. And that globally remains concerned, because one thing what COVID-19 told us and taught us is that no one is safe until everyone is safe. So a disease that can develop somewhere else in the world, that can easily travel to every nook and corner of the world, such as COVID-19, and bring the world to a standstill. What can prevent that occurrence once again from a different disease? Vaccination. Only the vaccination has that power to control an endemic and epidemic, bringing the world to a halt. Little more data on impact of vaccination in global health. Vaccination can and do develop herd immunity, and that's the goal for WHO, CDC, and other health organizations worldwide. It aims to eradicate various infectious diseases such as smallpox and polio that has been largely achieved through vaccination. It can prevent various infections such as COVID-19, diphtheria, tetanus, and malaria through MMR vaccination. Reduce secondary infections complicating vaccine preventable diseases such as influenza vaccine, and we have some vaccines in the prevention of cancer such as human papilloma vaccination can prevent cervical cancer in women. Also, we need to prevent antibiotic resistance so that we can treat various disease conditions such as meningitis, pneumonia, and urinary tract infection. Now let's take a look at the global COVID-19 response on behalf of CDC and COVAX initiative. COVAX is a worldwide global initiative that looks into the distribution, procuring and distribution of COVID-19 vaccines. Before going into the write-ups, let's take a look at the data, coronavirus around the world. This is very recent data as of 21st March last month. Total reported death due to COVID-19 stands at around little over 6 million today. And total confirmed cases of COVID-19 is over 470 million. New deaths, daily figures is over 3,000, and 1 million new cases are being added. So that's the status of COVID-19 right now. Data is a couple of weeks old. And top right-hand panel shows CDC's core global program leverage, that is leveraged for COVID-19 response. There are lots of write-ups and lots of figures in there, but without going through that, US is leading in this effort worldwide to stop COVID-19 and stop the pandemic. Also, there is a global influenza surveillance that is under the auspices of CDC, who also leads that effort, because every year, even in US, we lose about 40,000 souls due to seasonal influenza, which is not a small number. And if we look at the COVID-19 vaccine doses that has been pledged and donated, the dark color shows the shipped to the recipient country. US leads the chart, meaning US vaccine manufacturers that donated to the COVAX initiatives. This is a global initiative to deliver COVID-19 vaccines to different countries, disadvantaged countries worldwide, followed by European Union, followed by UK, Japan, Australia, and Canada. So we need to strengthen this COVAX initiative, expand scientific knowledge of SARS-CoV-2, strengthen global public health leadership. Thus, we can improve the long-term health security in low and middle income countries, because we have to understand that no one is safe until everyone is safe. That's one learning lesson through COVID-19 pandemic. This data essentially shows what I discussed a little in expanded form: COVID-19 global confirmed cases, global deaths, and unfortunately, in a single country, US tops the chart in terms of US COVID-19 related deaths. And down below, global COVID-19 vaccination, these are the doses given. Fully vaccinated, about 4.5 billion. Number of population, about 57% globally have been vaccinated against COVID-19, whereas only 20% received a booster dose. Now, with the emergence of the various variants of COVID-19 or SARS-CoV-2 variants, this is the data that shows currently we are all talking about Omicron and subvariants of Omicron. Here is the data that shows, this line shows that is dominating worldwide right now, Omicron variant and its subvariant. Good news is that who are vaccinated, they are handling the Omicron variant and subvariant infections at a much better rate, better way compared to the individuals who have not received their immunization or vaccination for COVID-19. And mortality, if we look at the mortality deaths per 100,000 population, these are the highest number deaths observed in these different countries in the world. And unfortunately, US is at the third position, right behind Brazil and Poland in terms of mortality, meaning deaths per 100,000 population, which I personally believe and many believes that we should not have been there. The 20 countries that currently most affected by COVID-19 worldwide, that includes South Korea, United Kingdom, Netherlands, Vietnam, Italy, Japan, Germany, Australia, France, and Austria in Europe. And these are the line diagrams over the years, starting from April 2020 through January 2022, over a 2-year span. This is where we stand worldwide in terms of COVID-19 infection worldwide. It's good news that COVID-19 worry is decreasing worldwide. CDC estimates that 95% of Americans have some level of immunity, either through natural infection or through vaccination. But when the perceived threat is low, the motivation to engage in preventative behaviors and getting a vaccine or a booster dose tends to decrease. And the diagram down below, a little fuzzy, apologize for that, but essentially what it shows, if you focus on this green area of this bar diagram, it talks about different countries in the world, such as Bangladesh and India topping the list. A large number of population that is represented by this green bar, they say that through this survey research, say that they are not at all worried about contacting COVID-19, even when they are not vaccinated. So this not at all worried about contacting COVID-19, the green bar is increased between May 2021 and March 2022. That is the data from WHO Southeast Asian report. And when that is translated into the line diagram, it looks like that. Again, I do apologize because when I downloaded this data from the respective website, it just became a little fuzzy. So what is the WHO program on HIV, tuberculosis, and malaria changing our gear from COVID-19 to other? Prior to COVID-19, we always have high focus on HIV, tuberculosis, and malaria. These three are the killer diseases and infections worldwide. So worldwide in 2020, about 1.5 million people died from tuberculosis. Yes, that is the data from tuberculosis infection death. About 0.68 million, about 0.7 million, I should say, died due to AIDS-related illnesses, whereas malaria killed about 0.6 million souls worldwide. So taken together, tuberculosis, HIV infection, induced AIDS, and malaria still tops the chart worldwide in terms of infection and infection-induced death worldwide. WHO Department of Global HIV, Hepatitis, and Various Sexually Transmitted Infection Program, which leads the development and implementations and strategy on the elimination of HIV as a public health threat. Meaning, after many decades of HIV research, HIV treatment, still we perceive HIV as a global public health threat. WHO Global Tuberculosis Program, on the other hand, envisions a world free of tuberculosis by 2030. No such target has been put forward or discussed yet in the context of HIV. But in the context of tuberculosis, by 2030, tuberculosis epidemic, in that scenario, 80% of drop is envisioned in new case development by 2030, which is improvement. And in the cases of malaria control, WHO Global Health Malaria Program, GMP, is responsible for coordinating WHO's efforts to control and eliminate malaria. Malaria is not a disease in Western advanced world, but it's a serious disease in Asian, African countries, particularly, and many underdeveloped and developing countries worldwide. Not incidentally, actually, December 1st is the World AIDS Day. US government's theme for World AIDS Day, which is December 1st every year, is ending the HIV epidemic with equitable access and with everyone's voices being heard. It talks about commitment to end the HIV epidemic globally, ensuring equitable access to quality and providing people-centered HIV prevention and treatment services. So, HIV epidemic control, in summary, envisions testing, treatment, and prevention strategies. And on the right-hand top panel shows the summary of the global HIV epidemic in 2020. The top line shows over 37 million people living with HIV in 2020. People acquiring HIV in 2020 is about 1.5 million and dying about 680,000. Those are the numbers still associated with HIV after many decades of discovery and learning about HIV. Still, we do not have a vaccine for HIV. The WHO and HHS strategic direction in this context is information for focused action, interventions for impact, delivering for equity, and financing for sustainability, and innovation for acceleration. These are the themes for global HIV control. And down below on this right-hand side panel, you see, I would not go through the details, but these are the missions and goals and strategic frameworks and priorities for elimination of HIV, viral hepatitis, and control of other STIs, sexually transmitted diseases, infections. Finally, in the context of infectious diseases, let's talk about tuberculosis. Tuberculosis is not a prominent disease, fortunately, in US, but the incidences are increasing in some parts of US where travelers come to US. But tuberculosis remains one of the world's deadliest infectious diseases, killing about 4,100 people each day. That's a large number. Nearly 2 billion people are infected with tuberculosis, 1/4 of the world population. CDC is committed to finding the cure and preventing all forms of tuberculosis at home and around the world. Because about 10 million people becomes ill each year with tuberculosis. And worldwide, tuberculosis is the leading cause of all HIV-triggered AIDS-related deaths, meaning HIV-infected individuals whose immune system is compromised, then they become succumbed or they fall prey to the other infectious disease condition, and where tuberculosis leads the pack. Every year on March 24, we just passed, CDC joins the global community to observe World Tuberculosis Day, a renewed commitment to end tuberculosis. This is the logo for World Tuberculosis Day, March 24th. What about WHO's malaria program? Malaria is the world's deadliest mosquito-borne disease, and in 2020, about 241 million cases of malaria with 6.27 million deaths reported worldwide. As we are struggling to control our current infection globally, COVID-19, we should not forget about the disease burden of malaria and other infectious disease that prevalence worldwide. And these are the numbers. Children under 5 accounted for estimated 80% of the malarial deaths worldwide in the malaria-prone region, where Africa carries a disproportionately high share or burden of global disease burden in malaria. About 95% of malarial cases and 96% of malaria-triggered deaths are from African countries. So what's the WHO strategy? Universal malaria prevention through surveillance, vector control, meaning in simple word, mosquito that carries the malarial parasite, controlling of that vector, diagnosis of malaria, early diagnosis, and treatment. Fortunately, there is a malaria vaccine developed very recently. It is not the best vaccine, that it's a subunit vaccine, RTS-SO1 vaccine. It's a subunit, meaning malarial parasite surface antigen vaccine that has been started administering in high falciparum. Is one of the strains of malaria, deadly malarial infection in sub-Saharan Africa. People started receiving that vaccination. It does not eradicate, prevents malarial infection totally, but it reduces the malarial disease burden significantly. So current strategy for malaria control is reduce the malarial case by 90%, reduce malarial mortality rates at least by 90%, and eliminate malaria in 35 countries. That's the WHO target in the context of malaria worldwide. So those are the disease conditions in the context of global health. But oftentimes we ignore a very simple fact that there are other aspects in keeping us healthy. In US and westernized world, Western countries, we oftentimes do not properly pay attention and give proper credit to access to clean water. But globally, there is a water crisis. 2 billion people live without access to clean and safe drinking water. Therefore, World Water Day was observed March 22nd this year to ensure accessibility of clean water worldwide. CDC's Global Water Sanitation and Hygiene WASH program aims to reduce WASH-related disease prevention and to strengthen the public health system, because water flows through every aspect of our life. And down below, you can see, if you look at these this diagram or these maps down below, the death rate attributed to unsafe water resources or unsafe usage of water in 2016, these are the countries, primarily in African countries, to some degree, some parts in India and Madagascar and Far East countries. There are significant number of deaths that can be prevented if all we have to do is provide those individuals, inhabitants, citizens of those countries with clean water to drink and use. Thus, it is truly said that water flows through every aspect of our life. Water crisis with prolonged drought in Las Vegas Valley is a prominent feature. And in conversation in the public forum in our Las Vegas Valley, because we all depend on Lake Mead for the supply of clean drinking water, sanitation, and etc. Various data points shows that in 20 through 25 through 30 years, that source can go dry very significantly, not completely dried, but can go dry very significantly, reduce at a very significant level, maybe forcing water rationing, etc. So water crisis, availability of clean water is not only a global issue, global problem, but it's knocking at our doors in the Las Vegas Valley. Finally, I'll dwell a little bit of impact of global climate change in the context of global health. Death toll and reach of vector-borne disease, infectious disease such as malaria and other diseases, vectors meaning mosquito-borne diseases in simple terms, is likely to rise because of global climate changes. As the climate changes globally, there are changes in the concentration, population, and various vector populations such as mosquito population that bringing various disease conditions worldwide. In 2016, around 4.2 million premature deaths were associated with fine particulate matter, meaning particulate matter, PM 2.5, this is related to the pollution due to the global climate change along with infectious diseases. WHO estimates that 4.2 million premature deaths due to pollution worldwide. Other health consequences of climate change and environmental biodegradation will be experienced globally through increased water and food insecurity, extreme climatic events, displaced populations due to severe climate changes, and that would lead to the vulnerable human settlements worldwide. Therefore, wealthier societies will suffer least from these global changes, whereas societies in the world, such as Sub-Saharan Africa's various South American countries, Asian countries, will suffer more compared to the wealthier westernized societies in the world. And impact of global climate change on our health is a sort of a new kid in the block. We very recently started understanding the real impact of global climate change on our health. So, where US stands in the realm of global health indices. There are lots of data on this slide. Forgive me if you can't read all of them, but essentially I would draw your attention that through all these data points, through maternal mortality rates, life expectancy worldwide, child mortality, and self-reported global health problems, these are the indices of global health. US scores overall high in life expectancy at birth, lower in maternal mortality rate. US do have very low child mortality rate and low self-reported health problem. Although I will draw your attention on the left-hand side lower diagram or the graph. It is not possible for any of us to read that, but essentially, this graph shows the life expectancy is increasing as more money is spent on health, but somehow US, if I could have enlarged this diagram, this graph, you would find US is lagging behind in overall health indices worldwide compared to the other healthy nations and other healthy countries, particularly westernized countries. And there are reasons for that, particularly important in that aspect, that there are huge disparity in US health in different populations, demographics, and areas where one lives within US. We need to pay focus and pay attention, improving our overall US citizens' health parameters. So to summarize, we will define global health is the study, research, and practice of medicine at very interdisciplinary level with a focus on improving the health and achieving health equity for populations worldwide. I would emphasize on this word, health equity for populations worldwide, because unless everyone is healthy worldwide, one would not remain healthy. COVID-19 has shown us that very well. Infection such as COVID-19 is the prime global health concern for last several years. Of course, in 2020, luckily, it's about to fading away worldwide. There are early signs of that. Other than that, various chronic metabolic diseases, malnutrition, mental health, this is a dark horse worldwide. Climate change and climate change triggered various water crises and other concerns are main focus for global health moving forward. Various international national agencies such as CDC, European CDC, and World Health Organization are the major agencies working at the forefront of global health. Community, national, and regional public health contributes to global health, meaning when you talk about global health, it begins in our community, in our neighborhood, then nationally, regionally. Ultimately, it leads collectively to the global health concept. So we cannot ignore community health if we want to achieve a healthy world, healthy population, global health. Thus, a healthy family and healthy nation is a prerequisite for a prosperous family and prosperous nation. Ultimately, it leads to the better global health. And within the realm of global health, vaccination has proved to be the most significant impact on improving global health. That includes current COVID-19 vaccination effort. Public health policies and adequate resource allocations are critically important for ensuring global health. And at the very end, I would mention that US ranks high in the realm of overall global health, but unfortunately, it ranks lower in life expectancy based on healthcare expense per capita compared to many European countries. This is where we mean the people who are involved in global health, in healthcare research, providence, etc. They should focus how we can improve our rank in life expectancy, that we can bring it up compared to the European standards and European countries when you talk about US ranking and US life expectancy all over the country. And that ends my presentation. Thank you very much for your attention. And now I will open up the floor, entertain questions that you may have for me.
Hi, everybody. It's not Vanessa, it's Amelia. I would love to kick us off with a question. You know, with COVID and all of its different situation, a lot of people have sort of taken the choose your own adventure approach to their getting the vaccine, not getting the vaccine, their choices, right, which ultimately do affect their community. So I'm wondering, how do you envision that sort of DIY, find your information attitude affecting our greater public health ecosystem at large?
It's a great question. Yes, after 2 years, in third year, we are still grappling with COVID-19 related mis and disinformation nationally, in our community, and worldwide. This is not a phenomenon that impacts just US or Las Vegas Valley, but it's a worldwide phenomenon. I have shown a piece of data in one of the slides. That data shows that worldwide, many individuals do not believe that there is a thing such as COVID-19 and it's a killer disease. So how do we combat this mis and disinformation? There is no one easy way to do that. Let me say that very upfront, because what we have learned in 2 years, actually moving on to third year, is that public health has been a neglected subject and a topic for decades. When one is not sick, that individual does not think about public health rightfully, and that individual does not extend their understanding into a particular disease, particular sickness, countrywide, community-wide, and worldwide. So to improve that aspect, we have to go back, as much I understand, COVID-19 related public health mis and disinformation. We have to go back to the baseline. What is that baseline? Baseline means we have to start a dialogue, a communication, beginning at a very grassroots community level, at elementary school, at middle school, at a high school, at a public forum like this. A conversation should take place in the classroom between a physician and their patients. How you remain healthy. And many of the diseases, we have cure for them. Unfortunately, for many of those, we do not have cure as we are learning about them. That conversation is paramount. At the same time, we have to develop the confidence that no one has the last word or the right answer. And there is nothing wrong in not knowing anything about it, rather than we can all learn individually and collectively to take the right measures to keep us healthy. For example, you rightfully said that COVID-19 kind of brought us into this scenario that a large section of the population worldwide, it's just not a phenomenon of Las Vegas Valley, US, or some other countries. It's a worldwide phenomenon. Many individuals started not believing that this is a serious disease. This can and does and killing people, killing our neighbors, killing our family members. I have my families back home in India. I have lost individuals due to COVID-19 infection. So when infection started, I did my best to educate them. As soon as the vaccines were available, I requested them to go get your vaccination. That's all I could do, staying across the world. So public awareness, giving the right information at grassroots level, making people understand that this is a serious disease. We have not seen this disease or any disease at this magnitude in our lifetime. This is a pandemic of our lifetime. We simply did not know what to do at the very beginning. Yet, scientists, physicians, healthcare workers, many activists, and many other people in this realm, they did miracle. They brought a vaccine in 2 years. It never happened in our lifetime in the world. Never did happen. So, but at the same time, what I believe that with the speed of everything, the vaccine development, the disease spreading all over the world, people did not really get a time to think about what is this disease doing to us, what is capable of doing, how we can prevent. And there were barrage of mis and disinformation worldwide, unfortunately started propagating as the disease was propagating all over the world. There is not a single blueprint that I can think of that would prevent the disease, spread of disease, and propagation of mis and disinformation worldwide. So perhaps we have reached at a time point in this pandemic of our lifetime where we can sit back, take a pause, and think what really happened here. There's still time. We can analyze, we can identify our shortcomings, our omissions, our negligence, and some deliberate disinformation came out from a very powerful sources that unfortunately large group of individuals worldwide started believing in. How we can prevent that? Now social research has shown that just saying the right thing doesn't do its job. You have to build the confidence in the healthcare institutions worldwide where people will believe in the authorities who spend their lifetime in understanding various disease condition, prevention strategies, and giving the guidance, developing the vaccines, developing the drugs, therapeutics, etc. We have to build that confidence. So perhaps the take-home message, there is no one strategy that would solve any of these problems. And this is not a problem essentially simply confined to US. This is a problem worldwide problem that people started not believing what scientists, clinicians, healthcare workers, and researchers, academicians are telling people. Rather, they depended on mis and disinformations on the internet and through various platforms. That became the source of mis and disinformation. There are ways to combat those, but essentially we have to build up the trust in people that people who studied this, their lifetime, through their lifetime, we need to believe them. We need to trust them, what they are saying, how to control this pandemic in our lifetime, because we never been through this globally. So there are many facets. There is no one strategy that will really help solve this multifaceted problem. It got to be a multifaceted approach where a social worker, a healthcare worker, a physician, a nurse, a teacher, a student, all of us at a community level, we can sit back without pointing a finger. We can analyze, we can try to understand what really did happen here. And through this collective dialogue, I personally believe that we would be able to develop a consensus opinion that would control the future pandemic. Hopefully not, but the next one, epidemic or pandemic worldwide in our lifetime. But it's a serious issue. We need to all think about it and work actively towards this eradication of this mis and disinformation.
Absolutely, thank you. Do we have other questions, whether on screen or in the chat?
Hi, can you hear me?
I do hear you, yes. Please.
Hi, Dr. Mandal, this is Mary Faye. So
thanks for joining
first of all, hi. First of all, thank you so much for your presentation on global health. And with the data that you presented, it is evident about the disparity of resources, healthcare resources. And you mentioned about sub-Saharan Africa, and you mentioned about Asian countries, which are both dear to my heart. As you know, I go to Uganda, Africa every year since 2014. And there is also a situation when 10 of our nursing students back in 2019 got involved with a mission trip. And I wanted to say that talking about global health data
Yes.
is significantly different from experiencing and witnessing the disparities in global health on the countries that you mentioned, specifically
Yes.
Uganda.
Yes.
And a case scenario that I wanted to share is about a young mother who was newly diagnosed with HIV and bringing her baby. And the doctor told the mother, continue to breastfeed your baby. And the eyes of my nursing students coming from the US with a different standard of practice, their eyes were wide open.
Yeah.
It's like, how could you tell this young mother to continue breastfeeding the baby? The baby
Yes.
will eventually get the HIV virus,
Right.
right? The disease. And after the young mother left, and the Ugandan physician told the students that you have to understand they don't have money to buy formula. They don't have any other option but to breastfeed their baby, right?
Right.
And if they don't continue breastfeeding the baby will die first from starvation rather than dying from HIV itself.
Right.
So I think with this experience, I mean, we can talk about global health and disparities, but we are not out there in those countries who need our help. We are just talking about it. But I think that reaching out to them and being there to supplement the disparity is very important as well. The data that you shared is like when I saw sub-Saharan, I go, yes, yes, malaria, yes, yes, HIV, yes, clean water, they need that, you know, and making sure that they don't have stagnant water around them.
Right.
I mean, they are more focused on having 3 meals a day, right?
Right.
So I think that it's very important. Your presentation, it really opens up a lot of issues and a lot of things that we in the US and other countries can help each other. And you have mentioned that what happens in other countries affect the US and vice versa.
Right. Right.
So thank you for your presentation.
Thanks for your comment, Dr. Axum. I know that we discussed this thing, both you and I are Fulbright scholars, and you are looking forward and I'm looking forward to serve our Fulbright tenure overseas. And yeah, you brought in a very important aspect that this mother you described in Uganda, HIV positive, breastfeeding, and through breast milk, that's the transmission, vertical transmission from mom to child for HIV infection. And the question becomes, do I start the child without breastfeeding in absence of other sources of milk, or child remains alive, but with HIV infection for the life? These scenarios poses the real crust of global health. We can bring many data, but the scenario, the case that you presented, that is global health. And I'm so thankful that you gave that example. What one does at that point, it's not an easy question to answer, but as we understand, increase our understanding in these issues, in the context and realm of really global health, in looking at the other countries, and your life experience tells you that how important it is to understand that how these infectious diseases gets transmitted and where they can be stopped by a simple intervention of bottle feeding instead of breastfeeding for that child from that mom. But what is the barrier? The barrier is non-availability of a formula that would keep the child alive. So thank you for sharing your life's experience, and both of us looks forward sometime to serve in our capacity as a Fulbright scholar, going into the other parts of the world, talking about global health and health-related issues.
Yes, looking forward to it, Dr. Manaz.
Thank you.
All right, do we have anything else? Hearing none, seeing none. Thank you so much for this presentation. Thank you to everyone for being here. We will get this recording sent out tomorrow. Have a good evening, everyone. Take care. Stay well. Thank you so much.
Thank you. Thanks
Bye.
for attending. Bye-bye.